morning.
There we go. Good morning.
Let's try that again. Good morning.
Good morning.
Thank you so much. Welcome. My name is Vanessa Cummings, and I'm a health educator with the Health and Racial Equity Unit. Thank you so much for being here today and joining us and reimagining community engagement to advance health and racial equity. But before starting, I want to ground us and just recognize the land of the Sacramento area. The history of the Sacramento area and the people is rich in heritage, culture, and tradition. This area was and still is the tribal land of the Nisenan people. Sacramento was a gathering place for many local tribes who have lived throughout the Central Valley and the foothills for generations, and the original stewards of this land. We'd like to acknowledge the Southern Maidu people to the north, the Valley and Plains Miwok-Miwoks peoples to the south of the American River, and the Patwin-Wintun peoples to the west of the Sacramento River. We also would like to honor the Wilton Rancheria, the only federally recognized tribe in Sacramento County. And we acknowledge that we are standing on the tribal lands of Sacramento's indigenous people. And then I also want to recognize and acknowledge the labor upon our country, state, and county, the labor upon which our country, state, county, and institutions are built. We remember that our country was built on the labor of enslaved people who were kidnapped and brought to the U.S. from the African continent, and recognize the continued contribution of their survivors. We also acknowledge all immigrant and indigenous labor, including voluntary, involuntary, trafficked, forced, and undocumented people who contributed to the building of this country and continue to serve within our labor force. We recognize that our country is continuously defined, supported, and built upon by oppressed communities and peoples. We acknowledge our labor inequities and the shared responsibility for combating the oppressive systems in our daily work.
Good morning, everybody. I want to just ground us as well to welcome everybody here present today. We are here, different journeys, learning, new opportunities, and growing together, and we want to welcome you all. Everyone brings a unique perspective, unique experience and lived experience, and we respect all that you come in with today in this space. We want to welcome all of race, ethnicity, African descent, Black, African American, Asian descent, Jewish descent, Arab descent, European descent, those who identify Hispanic or Latinx or Afro-Latino, people indigenous to this land, and people of mixed and multiple descents. We see you, we welcome you. We also want to welcome all of class, all working class, middle class, owning class, people who aren't sure what class they might fit in. We see you, we welcome you. We also want to welcome all of those who identify maybe as less mobile, visible or invisible disabilities, and all orientations, gay, lesbian, bisexual, heterosexual, pansexual, asexual, queer, and anyone with different orientation outside of these labels, we welcome you. And people of all faiths, people including atheists and agnostics, we welcome you to this space today as we celebrate. Did you hear me? As we celebrate. Can I get some claps? For the Health and Equity Action Plan for Public Health. And we could not have done that without you, without our CBO's community-based organization. So we welcome you all this morning.
Hi, everybody. I am Jillian McKinney, and I am with the amazing organization that you see in the white shirts around here called the Equity and Wellness Institute. Excuse my voice. There was a concert of my childhood dreams on Saturday, so TLC was at Thunder Valley, because hello, can I get a little hello? Okay, so, waterfalls, I don't have a voice, so excuse me. But thank you so much for being here today. We come into this work at the Equity and Wellness Institute with our hearts, our full hearts, and from our mission, and that has been guided by Dr. Tamu Green, who is sitting in the back, so everybody take a look at the back there, that's Dr. Green. She is our CEO and our founder, and when she started this amazing organization, she started saying we need to be committed to helping institutions do right by their communities, and that is what we do every single day. And in this work, it really is foundational to know your why. And what is your why? I came to this work in a really interesting way. And I think a lot of us have that story. And I want everybody to think a little bit about why you are here. What drives you to do the work of racial equity when so many folks around us maybe don't feel like it's as important as it needs to be? Mine came when I was 8 years old. My brother came home to the schoolyard. I get a little emotional, and I got no voice. We're a mixed race family. I'm a little lighter. My brother's not. And when we were growing up, my family moved us up and out from the Bay to have a better life. That's what they thought. That's what folks in the 80s did. And when he came over and said to me on the playground, "This kid won't stop calling me these names. What's going on? I don't understand. I never heard these words before." He was 4, right, going into kindergarten. And at that moment, I realized this is my work. I gotta do right by that kid. I gotta make it so that this kid grows up in a way that we all are equal, right? So that was my why. So when the kids used to ride by our house and throw up the Confederate flag and tell us to go home, that was it. I was stuck. Y'all are stuck with me. I was gonna be a warrior, and that was just what it was gonna be. And so that is why I'm here. That is why I do this work. Our team is dedicated to this work, and so when we started to partner with the HRE team at Sacramento County Public Health, that's what we bring every single day into the work that we do. So I want y'all to think for a minute about your why you sit here, why you get up every day and do the work that you do. Sort of make space for your counterparts. What is said here stays here, but what is learned here leaves here. And we really are guided by that. We create brave spaces because we know that for lots of folks, especially lots of folks like us, not all spaces are safe, and we know that. But we want to be brave. We also want to be really present because the people here are dedicated to the work that y'all are doing too. We want to listen with intent to understand, right? We really want to do that. We want to offer what we can and ask for what you need. If you need clarification, please let us know. If you'd like to learn more, please talk to any of us. We would love to explain or give you a little bit more. And we want to really hone in on one conversation at a time, right? Really sticking with what we want to do. That's the learning environment that we've set up for today.
When we talk about brave space, we talk about action and accountability. And I just wanted to clarify that because sometimes when people ask, well, what's the difference if you're talking about safe space versus brave space, we are creating a safe space, but we are creating one in an environment where we're here about the action and the accountability.
Thank you. I want to just shout out to my team, and they are sprinkled throughout, but we've got Dr. Green, she's in the back, you just saw her. We've got myself, we've got Fabian Perez-Gove here on the side, and Danielle Hawthorne, and that's the team that we roll with. We really appreciate everybody being here today, and I'm going to hand this over so that the HRE team and the Sacramento County Public Health team can really talk a little bit about how they got here.
Good morning. My name is Jamie White, and I'm here to say a few words on behalf of our health officer, Dr. Olivia Cassirier. It's been a long-standing dream of Dr. Cassirier's to create a Sacramento County Public Health and Racial Equity Unit, and we've reached a major milestone with the development of the first Health and Racial Equity Action Plan. In 2020, the Board of Supervisors passed a resolution declaring racism as a public health crisis, acknowledging that systemic racism leads to disparities in healthcare access, outcomes, and quality of care, contributing to higher rates of disease, stress, and mortality among people of color. On behalf of Dr. Cassirier, thank you all for being here to honor Juneteenth as a day of celebration, reflection, and solidarity. And thank you for continuing our momentum by reimagining community engagement to advance health and racial equity. Thank you.
Thanks, Jamie. Hi, everyone. My name is Gerline Roberts. This is my team. We are with public health within the county under Department of Health Services, and we're a division in public health. And so I just want to give a shout out to my team. If you guys could stand, I know you're standing over there. There's Kirby, right here, Aurelie, Vanessa, Cassandra's at the check-in desk, Tim. There you go. Thank you guys. This has been 2 years in the making. We're so proud. That was my word in the introduction, to be here and to reach this milestone. And so just a few things I want to call out on like how we got here. I don't want to spend too much time here because we've done a whole presentation on just this slide alone. And so Jamie had mentioned in 2020 the Board of Supervisors declaration. Just want to be clear, this top is the layer is like Sac County's work towards racial equity, and then this is public health at the bottom. And so I know the timeline starts at 2019. We've been doing this work much longer than that. But just for some high-level stuff here, in 2021, Public Health, we received a CDC grant that has helped fund this work, hired 6 staff, which we just introduced, and then hired a few subcontractors to help us with assessing community engagement, developing this action plan. And then a lot of infrastructure building. And so there's links here for all the documents. At the county level in 2021, we had, 2022, the DEI cabinet was created, and there's a DEI officer hired in 2024. And so we do work with them very closely, and you'll be hearing from her later on this afternoon. Her name is Stephanie Jackson. So I'm gonna go ahead and, oh, she's here today. Wait, raise your hand, there you go. Hi, Stephanie, thanks for being here. And so I'm going to just kind of skip ahead and just say the purpose of the action plan today is really to focus on internal infrastructure for the public health division. And we do have a CHIP, it's called the Community Health Improvement Plan. That one focuses on the community's needs, and is run by lots of different community organizations. If you would like to get plugged into that, please let me know. Tim and I lead that work, and so we won't be presenting on that today. A few things for awareness. Jamie mentioned this already, but I just put it on the slide just so everyone's clear. This is the first racial equity action plan for the county and for public health. And then also, we heard that community engagement and transparency is very crucial, and we intend to continue the transparency as we share progress on this work over the next 5 years, 10 years. And our goals are all focused on the internal infrastructure. The CHIP is focused on the external. So, and there's 4 sources of data that went into the goals that we created in the plan. Today, you'll really only hear about the first one, equity and wellness's findings. They were by far the largest findings and where most of the community engagement was heard. So we wanted to include that, but the other 4 are also listed. Happy to go into those. We will talk about those in a little later.
Okay, y'all. Today, we're going to do a couple of things. We're really taking a look at how we can look at opportunities for collaboration and coordination, and that's why we're all here. We're going to talk a little bit about the Health and Racial Equity Action Plan and the findings that the Equity and Wellness Institute found during this pretty close to 2-year process. We're also going to take a look at how Sacramento County Public Health can champion health and racial equity, build trust, and strengthen those relationships with everybody in this room and who else you are connecting with in your everyday work. And really, this last piece is to be in collective space with other equity leaders from this region and really grow connections and do the work that we need to do in order to make sure that we do not have any more, or we can work on clearing those disparities, specifically of health. We want to talk to you a little bit about how we got here in the equity and wellness space. So our team takes a look at what racial equity action plans are, and we really put theory of change into action. So we're going to talk about centering race all the time. We know that it is the #1 determinant of health in this country, and we have to discuss it. There's lots of folks that maybe don't want to center race. We have to, and we know the why, right? So we're going to normalize those discussions. We're going to lead with the why, and we are going to prioritize and get buy-in. We're then going to organize, and that's what this racial equity action plan you're going to see. It's really about how do we create internal capacity and how do we get those really intrinsically motivated folks in these organizations to work with the folks that they need to. We're then going to take the tools and the policies and we're going to put them into business procedures because we know that these systems were not made to support most people. And we need to figure out how to work within the system, but we also have to move within the system. All of the data today that is presented by many different ways that we collected, and we'll talk about the methodology in just a moment, is going to inform those strategies and the results that ultimately were linked to the Health and Racial Equity Action Plan. Here's just a couple of things about racial equity action plans. They are by not at all a means to an end. It is a growing, living document. It's a process, but there are very clear results and clear visions, and that's really what we need to make sure of. It's structured to achieve measurable and meaningful goals. It's supposed to be transformative. We have to work within the policy, and we have to leverage existing policies to change. Also, how do we create accountability? And this really is the foundation. How do we know that we're going to say we're going to do the work, but we're actually going to do it, and we're going to measure that? That's the most important piece. I want to just talk to you a little bit about our process. We had many different levels to this work. Again, this has been about a 20-month project, and I was fortunate to be able to lead this project along with our team. But we have different folks at the Equity and Wellness Institute where we've been all working collectively. First, we did a document and data review of internal Sacramento County public health documents. That was a bear. Fabian and we really went deep into that part. We then took a look at what other folks were doing in public health around the state and around the country, right? We did an environmental scan. We also know at the Equity and Wellness Institute that we've got to talk to the community. So that was a major piece of this entire work, was to do a focus groups to make sure that we could really set the stage for as much qualitative and quantitative data as we could get. We then took a look at Sacramento County Public Health resources, how certain things were funded. We're able to find findings and then also into what the recommendations would be. We took a look at their mission and their vision and their values and their strategic goals, and really that all encapsulated. And honestly, the most exciting work is what we call the community-based participatory project, which is where we went straight into the CBPR process, the community-based participatory research process, and we partnered with 5 local CBOs who are all here today. So I'm going to stop for a second, and I just want to give every single CBO who was a part of the community-based participatory project, could you please just raise your hand if you're a part of that? Let's give them a huge round of applause. You're going to hear from them. You're going to hear from them in their exciting projects, some of the most transformative data collection ever. So exciting. And so we took all of that work and we said, all right, what are some themes? How do we see what these findings are? And how do we then know how to sort of give the best information to the HRE team so that they can take that and create their health and racial equity action plan? Here's just a little bit of data, just so that you can understand what we also did. One thing I didn't mention was actually we did internal and external interviews of Sacramento Public Health staff, and we did interviews of community partners. We also did focus groups. We had a town hall for Sacramento County Public Health staff as well, where we took all the information and that rolled into our findings. And then the largest piece, which was the 615 community members that participated in the community-based participatory research project. Let's talk a little bit about the findings, because we want to really give you some insight into what went into this process. Here are some of our findings. And I will just tell you, you're going to see the word community throughout this entire slideshow more than you're going to see anything, and that's how it should be, right? Include the staff and the community input into the decision-making process. That this needs to be, community engagement needs to be the highest priority. that there is possibly some unclearness of how health and racial equity has been incorporated into structures since the Declaration, but that's been being worked on. And there's also a need to reevaluate some of the hiring practices. So some of this is community-based, and some of this is internally based. So the processes that's happening inside Sacramento County Public Health, these are some of, the things that you're gonna see in the actual HREAP. Community engagement is not as displayed as a guiding principle in their internal documents, so that's going to be shifting and changing. When we looked at best practice research, other health organizations throughout the state and the county, one of the things that we found is that it may be unclear what internships and programs cultivate leaders to encourage participation in the community. So this is one of the findings that will then lead them to shifting some of their internal processes. There is need for additional collaborations and partnerships with other organizations that maybe they do not have direct partnerships with now, specifically with communities facing the greatest inequities. We're going to use that term throughout all of today, communities facing the greatest inequities. I also just want to caveat that we know in this work, language shifts and evolves every single day. So what's written here today may not be used in a year, but we know that, and we use that idea of evolving language. We also saw that organizations who are already engaged in racial equity work need to be highlighted more and make it more accessible on their internal websites. Our internal and external interviews showed us a lot. And one of the things that we really want to highlight today is that the staff at Sacramento County Public Health really do recognize the importance of community engagement and input, but they're needing some support. And that is what you're going to see come out in the HREAP today. Staff are also concerned about their reputation within the community, and they are starting to see a shift in prioritizing community engagement and outreach, but would like more help and more support of how to do that more effectively. Community partners are also interested in collaborating, but shared that some of the administrative guidelines were strict, as we know, and that are possibly a little more demanding. So you're going to see later in the HREAP that there's going to be some information about how to actually make that an easier process. Community partners stress the importance of really being updated on what Sacramento County Public Health was doing within their race and equity work, and that is really important. Some of the staff from the staff town hall, which was which we had a lot of information come from, stated that they really wanted communication methods throughout their organization and outside to the community. They felt it was a bit siloed, and they wanted to make it so that it was more streamlined. Collectively, the staff requested that leadership and staff must actively strive for health and racial equity, and wanted to really make sure that they instilled that in their workplace culture. Some of the staff members stated that authentic community engagement was needed, and that the community needed to be co-creators of Sacramento County public efforts to address health and racial equity. So it should not be a top-down approach. It really needs to be an equitable approach where the community is really centered. They also acknowledge that there is internal bias and racism present among staff, and that can absolutely lead to disparities in access to high-quality care. One of the things that was what we did when we evaluated resources, that we took a look at different programs and how they allocated their budgets. It was not a full review, so I just want to put that caveat there. It is unclear, though, when we were looking at this, if there was funding for specific mitigation or preparedness when it had an environmental justice lens, especially how folks in those initiatives for communities facing the greatest inequities. So that was a finding there. We also want to take a look at there's a major need to diversify how revenue streams are allocated, and that that CBOs need to be really at the forefront of working with within those budgets. and that there is a very serious need for health and racial equity training, and that work has already started to happen within the last couple of years, specifically because of the HRE team. From our focus groups, we want to highlight that folks really said that they had pretty good community engagement throughout COVID-19 pandemic, but they wanted to build upon that work. They stated that they would benefit from partnering with local CBOs, and this would really drive the work. As I told you, community engagement and local CBOs, very much the highlight of this work. We also found that they really wanted to be part of engagement, meaning that from even the focus groups and other spaces, that it really was important for the CBOs and the community members to possibly sit on committees or have committee that was dedicated to this work. And that it was really important to adopt similar community engagement practices of Sacramento County Public Health Behavioral Health Division. That was spoken very widely and positively as we spoke to the community. And you're going to hear much more from each of our CBOs today, but one of the things that was really important here as a finding is that they really wanted to have Sacramento County Public Health have a culturally centered approach to outreach, and that they felt that the current approach was more of a one-size-fits-all model, and that is not the best way to engage with the public. There is a major interest in having a coalition or a consortium that provides opportunities for these community-based organizations to work directly with Sacramento County Public Health. And that they really want to share feedback on Sacramento County Public Health programming initiatives, and felt that that they could do that with this proposed coalition, and this would be a space to make sure that communities had a voice. Within all of these different methodologies, we really all took all of that and we came up with 5 themes. The theme of community engagement, the theme of workforce and capacity, organizational policies and practices, workplace culture, and communications. And this is what we put together and gave to as one part of the foundation that you will see that will go into the Health and Racial Equity Action Plan. So I'm going to stop there for a second. And as you see these themes, you will see them morph a little bit over time, and you will see them sort of morph into three bigger sections. And I'm going to hand this over to Tim from the HRE team, who's going to talk a little bit about how they came to put together their Health and Racial Equity Action Plan. Thank you, everybody.
Thanks, everybody, and thanks, Jillian, for that intro. As we spoke earlier, Gurleen had highlighted this. When we talk about the Health and Racial Equity Action Plan, the equities work and the recommendations and evaluations form one major piece of the HREAP, the Health and Racial Equity Action Plan development process. But as was mentioned before, it was a 20-month process. It's a very long process, and during that period, we also had an opportunity to add other pieces of information and insights. And I'll walk you through some of those additional pieces. So first of all, we want to highlight that one of those pillars was also this community health improvement plan. So this is a project that's been ongoing over the last, I'd say, last year. And through that, it's essentially a 5-year process that's working to improve community health. And this is another example of how there's essentially an interplay between these new and emerging data sources, feedback mechanisms that were incorporated in the Health and Racial Equity Action Plan. And it runs on this 5-year cycle. And essentially, the point here is that a lot of the policies and projects that we work on do not exist in a vacuum. And it's intentional that the HRE staff, among others, are leading the work on the CHIP side. And what you'll find is, over this presentation, is that there's key pieces that are where you're going to find commonalities between the HREAP and the CHIP process and other elements. And just to acknowledge, again, I've had the privilege of playing a role in the county's CHIP process. Raise your hand if you've sat in on a meeting or you've talked to somebody about the CHIP or are somehow engaged. Wow, I'd say it's at least a quarter or maybe even half the room. So again, I think this is the kind of work where we are trying to essentially show that when we think about how the CHIP priorities were determined, housing and security, mental health, and food access, that very much that there's an interplay between some of those priorities that were selected, the process in which we went about that, even the consultant selection in some ways are all elements of how we want to live and practice these the values that you'll see in the HREAP. In 2023, we engaged with a consultant, On-Track Program Resources, a fantastic consultant, and they helped us implement this staff survey. And what we found in that, in administering this survey, which I think reached, we're an organization at that time was around like 350 staff, and roughly 290 staff took that survey. And through that process, essentially what we were asking staff is, and again, this is another emerging data source, was what is staff's appetite for advancing health and racial equity in Sacramento County Public Health? What topics are of interest? How deep do they really want to go into this work? And what we found was that a few things. Most, if not all, respondents agree that advancing health and racial equity at Sac County Public Health is important. We found that over 1/3 said that they do not face any racial injustice or racism challenges in their work. And again, this was a structured survey tool that was developed. We also found that respondents at all levels prioritize some sort of training or education for all levels of staff. And again, these were critical insights that we had never really marked a line in the sand and say, hey, we really want to methodically assess this work. We also found that some of the training topics that staff wanted covered were things around supportive spaces, terminology, conversations around health and racial equity, identifying and addressing institutional, structural, and systemic racism issues, and then also training for hiring and promotion of hiring and promotion committees. We also found that many respondents acknowledged that the steps Sac County Public Health had already taken a number of steps, but many expressed feelings of frustration that the steps had been all talk or checking the boxes. And this is really not unique to local government or large bureaucracies. And I think it was important and critical that, again, we were essentially taking stock of what the feelings truly were among staff. We also found that respondents at all levels, respondents at different levels had varying ideas about how to improve the diversity in staff and in promotions, but overall agreed that outreach networks needed to be strengthened and needed to be more diverse. And a common theme is that overall, the staff were ready for action. Another tool that I'll discuss that was incorporated into the HREAP is a tool developed by the Department of Public Health, the California Department of Public Health, their organizational assessment for equity and infrastructure. And in this tool, and again, I know it can be difficult sometimes to think, how do you really assess the equity infrastructure of these various organizations? And we know as a government town, there are many, many organizations. And I encourage you to look at this CDPH organizational assessment for equity infrastructure tool. It's probably one of the most succinct, and I would argue one of the more robust tools to look at, to do internal reflection for your own organizations or organizations that you work with. And essentially, the objective of this was targeted for local health jurisdictions to have this kind of streamlined tool to collect data on their current equity infrastructure and use it for future planning in equity. And this was, again, a tool that we now use on an annual basis. It's sort of self-assessed, but the whole point of it is that it's a pretty flexible tool that allows staff to internally reflect on their equity infrastructure, which we know is really the critical and key, one of the key and critical components for scaffolding the work to improve health and racial equity, both internally in the organization, but as many of the community folks who are here know, that it's important to do that external work as well. And again, it's very difficult to do, to advance racial equity if you don't have that internal structure and scaffolding. And then just to note that this is a tool that we are now institutionalizing on an annual basis as one of our ongoing efforts to assess our health and racial equity capacity. And again, this provides another data source and another approach to informing our health and racial equity action plan. And finally, I'll mention the guiding principles. We've talked a lot about tools and assessments and new information that we're gleaning every year, but the guiding principles is really the hard work, where we really feel that when we're in moments of conflict or dealing with challenges, or budget cuts, or whatever, this is what we want to come back to at the end of the day. And these are our guiding principles. Much of it gleaned out of a process that Equity and Wellness was leading, but also through our CHIP work, and also just some of the new information we're finding through those tools I just mentioned. One is just around evolving language. It's striving to create processes and systems that are rooted in racial equity and justice, that we commit to refraining from using harmful language. And again, as an example, it's not just certain types of language, it's also just unpacking things like when we think about the Asian API moniker, right? It's not just saying we're just going to put everyone into a bucket. If we hear a community organization saying, hey, we actually need the Pacific Islander community to be further extrapolated out, like we need to show up, we need to do the work, and not put it on other organizations to say, hey, we just don't have it, check next year. I think that's the kind of the work we want to do. Moving at the speed of trust, fairly obvious, but this is probably the most time-consuming. It's probably the work that we know is not easily, doesn't have an immediate benefit in the next month, but really we're talking in the cycle of like years, but it's the investment we want to do. Building belonging is another key piece, which is making sure it's more than just feeling welcomed or included. It means addressing and sharing power, access, opportunity, having those humble conversations where we're able to reflect on public health's historical deficiencies, but also working from a position of trying to do better. And this is kind of where the building on strengths piece comes in. And I think this is both internally within our organization. We can talk all day about how we don't have this or we don't have that, or we're not San Francisco. But at the end of the day, like this is our community, this is our home, and it's critical that we build on kind of the assets that we do have. We have an incredible wealth of resources here, both in our organization and also drawing on those strengths within out in the community as well. And again, when we're presenting and talking about targeting a community or working with a community, how do we ensure that it's more strengths-based and asset-based instead of saying, going through the litany of really harmful data that we know government systems have had a hand in, but also unpacking it in a way where we can look at that data in a more positive light and work from a position of strength. The other piece is around community power building. We want to build trust, relationships, and partnerships with community organizations and residents to ensure there's intentional power building. We don't, and the other converse of that is, of course, transactional power building. We don't want to kind of move in those spaces where it's just a one-off, we need somebody for a grant, we need someone to step up. It really is about relationship building, and that is mirrored in both our, again, the digital infrastructure. Like, not only do we want to maintain better contact lists, so we're not over asking organizations to fill out the same survey, but it's really saying, like, moving beyond the survey and saying, what is our timeline? What is the cadence and speed that we want to move at? And how do we ensure that we're deliberately building power in a way that when those hard decisions are faced, Sac County Public Health, that we're moving in a position where we're drawing on those relationships so that they can help us get through crises, and similarly, we can help community organizations get through some of the challenges they may have. And then the final piece is just around aligning infrastructure. This is probably some of the most critical work, in part because There's Sac County Public Health policies, there's processes, there's practices, and that's happening at the division level. We also exist within a larger department of the Health Services, Department of Health Services, and that sits within a broader Health and Human Services kind of like, kind of bucket. And then you move kind of to the county executive level. And there's also, of course, stuff that's happening statewide, the CDPH tool. And how do we make sure that that we are essentially aligning infrastructure, and specifically aligning infrastructure in that domain. A couple last things I was going to mention is just the HREAP areas of focus. Ultimately, we whittled it down into 3 larger bucket areas. One was community engagement, building community power to deepen relationships, trust, and support structures that foster strong collaborations within the community. The other was around workforce and capacity building. Again, the goal is to recruit, hire, and develop professional workforce that continues to reflect the population served and communities facing opportunities for staff to learn and discuss equity topics and incorporate their learning into critical practice. And then finally, another area of focus was equity and organizational policies and practices. Strengthening organizational equity infrastructure to advance health and racial equity through policy and program development, effective communications, community engagement, and then monitoring and evaluation. Overall, collectively, these the 4 data sources I mentioned yielded these areas of focus. And again, learning from from the work of that Equity and Wellness was leading, our learning from the CHIP, our equity capacity survey, and the state equity infrastructure assessment allowed us to again move into these 3 domain areas. And I'll highlight that the complete HREAP will be available in the next few months. But one of the things to talk about is just some brief lessons learned throughout this entire process. One was that the employees in the community are ready for action. That was just over and over. It's like, okay, we've talked a lot, we've written a lot, we've assessed a lot of policies, and now it's time to get to work. Which is why this event is sort of bittersweet. On the one hand, it's this overwhelming sense of, getting to this culmination point, but at the same time, it also is the opportunity to kind of unleash the work, the work that we've been working on, but that we also want to do in a more accelerated way. Community engagement is a top priority, and that emulating the spectrum of community engagement to ownership will help us build positive relationships. And that there's an opportunity also to build staff capacity around health and racial equity by ensuring that there's an abundance of training and educational opportunities. And also to provide supportive spaces in local government and specifically in public health. The other is the other learning is that is ensuring that the workforce is reflective of the community at all levels of the organization. This comes up time and time again. And that there's also an opportunity to strengthen internal and external cultural and linguistic cultural practices and protocols. Again, another area of learning for us. The other piece is around also ensuring that we have dedicated staff that have a positive impact on building equity infrastructure and advancing equity. That dedication having dedicated equity staff, beyond just the one staff person who's going to do everything and take in both do the internal work and the external work is incredibly difficult. And I think there's a lot of foresight on Dr. K's part and some of our staff to build in an entire unit in this work. Finally, that the CDPH equity infrastructure framework has been a really powerful tool for public health. It's allowed for some streamlined data collection on equity infrastructure, allowing us to kind of monitor progress and inform the plan and the Sac County strategic plan, which is something that we're working on as a separate but related exercise. And then the final piece is that accountability is key. Public health employees and community members are eager to build accountability processes within and around the Health and Racial Equity Action Plan. And this is just the final piece around alignment. Again, this is really thinking about like why this work, why now? And, I think there's a lot of, it's both strategic, there's also some luck, it's a combination of a lot of things, but that it really helps to have deeper alignment that's happening both at the state level in their state health equity plan, which is on the left, which talks about workforce and capacity building, organizational policies and practices, and community engagement. And then within within that space, you have, and within CDPH, you have this kind of organizational assessment and equity infrastructure, again, similar in domain areas. And then our HREAP, which again sits within that. And again, I know Stephanie will be talking later about this, but it feels really good to actually have, I think for the first time, I mean, possibly in a long time, and possibly for the first time, this deeper alignment that's happening at the county executive level, also happening at the department and the division-wide level. And again, we have our colleagues at Behavioral Health and First Five, and again, it just feels tremendous to build this momentum collectively, because it's not just public health, we're learning significantly and deeper insights based on what all these other entities within local government are also doing.
Hello, everyone. My name is Morgan Brown from Call of the Block. One of the questions, I guess, that I did have, just for clarity, as far as how the goals and objectives for the HR EAP program versus CHIP, is the process for like execution going to be the same? I know that they're like two initiatives separately, but as far as like execution, and I say that because like the goals itself pretty much kind of line up similarly. Just trying to understand how we'll be able to kind of see like the results driven based on this information.
That's a really good question, Morgan. I mean, I would say maybe the clearest distinction is that the HREAP is really focused on like internal infrastructure. And so when we think about, let's take an example of around like hiring practices. The CHIP really, wouldn't really cover that per se, and that's because CHIP is really focused on community health improvement. But you are asking a great question, because I think there is some overlap. So as an example, when you think about like staff, improving staff training, for example, right? That staff training, or like in the HREAP, that's really geared towards like just staff. So we're running like a cohort, Equity is helping us lead this work in community engagement practices. We're training 50 staff roughly. We're training 50 public health staff in the practices around community engagement. And we know that that's going to be that's something that staff have asked for. And so that's one domain. And if you think about an accountability piece around that, we might be asking at the end of the year, hey, how many staff have we trained? How many people attended at least 80% of the classes? How are you going to apply that work, right? But if you switch over to the CHIP domain, you might have some staff who are trained who might then be using those skills in community engagement to then use it in the community health improvement plan, the CHIP process, which is happening over 5 years. So I feel like that's just like one small example, but I guess maybe in a reductionist way, one is more internally focused, and then the other is the CHIP is predominantly externally focused. The reason I think one thing where we can really learn is like, how do we ensure that our transparency systems and accountability systems in the CHIP, which I think are going to be pretty strong, just because that's who the core audience is, might be embedded in how we look at accountability for the Health and Racial Equity Action Plan in Sac County Public Health, because we often don't do that, right? How many staff got trained, how many outreach events we had about hiring. Like, these are things we just keep internal, right? Part of it is that we feel like the public isn't as interested, but maybe there is an opportunity to elevate both of those platforms, because they really should go hand in hand in some ways. I hope that helps.
Yes, thank you.
Hi, Lynn Berkeley-Baskin, Justice to Jobs Coalition. First, let me say thank you to this team, both teams, everyone who's involved in this. Having been involved in the county and doing community health equity for over a decade, this is a long time coming, so thank you. But I'm wondering too, I loved what you presented, and also I'm recognizing that in the assessment for equity infrastructure and also in the comments made earlier, there was discussion about how the staff is ready, right? Everybody's ready to go. But I'm wondering, has there been actual discussion or just kind of this assessment, this written assessment? Has there been actual discussion with the decision makers about structure? Because structure is one of the biggest barriers that I've seen. Systems, I understand that we are working on systems, but really I see organizational structure as a huge barrier. And so I'm just wondering if people are actually ready to discuss the county structure.
I know that our team has been in various spaces at different levels of the county in discussions with like there's an interdepartmental team that has been working on this. There's the DEI cabinet, there's our external CHIP. So there have been discussions, at least from our public health team, on like where the team should be placed in the org structure, how it reports to like Dr. K and above. Of course, we are a very small team in a very large organization, and so I would probably want to defer to Jamie on like maybe above us how that works, but.
Yeah, and thank you for that question. We have had some of those discussions. I think some of it is not necessarily in our capacity to change, right? There's government structures that are in place that we try to navigate, and I think some of our focus has been more on how do we navigate that effectively, recognizing that we cannot change certain elements about certain structures and hierarchies. And like Gerline said, we have a huge organization. Public health in particular has grown quite a bit. And I will say that since it's grown in the last several years, it's actually a much flatter hierarchy than it was initially, which is much more vertical. And that does also present some other challenges, right? When you kind of resolve one issue, it kind of brings up some others that we navigate. So we have slowly moved that direction. I don't know how much further we can realistically move towards, but we are certainly having those discussions internally.
I'll add one more piece, and Gerline touched on this. I think one of the ways that, frankly, a stronger Sac County Public Health, essentially, I think, means a stronger Sac County government, right? And what I mean by that is we have staff here who are creating these intentional spaces called like the Power Hour, right? Where they're essentially staff who are coming together, talking about these sensitive issues and just creating a safe space, if you will, right? Think of college campuses and, having sort of, Black-led spaces, talking about kind of more sensitive issues. And we're trying to create platforms like that other departments can replicate. I sit on the capacity building for CBO's team. That's a countywide initiative, but again, public health is in that space also. There are several examples of that, and I think part of it is like, how do we take what First Five is doing, what behavioral health is doing, and I think, I guess the trend is they're more, we're all kind of more in the human services, public health space, but their ability to bring their deep insights and operationalize, show voice, talk about their approaches and techniques is, I think, what can make, frankly, a more just and kind of humane Sac County, right? Because they're then working in spaces with general services, contracting, with potentially with probation. And again, I think that's where a stronger kind of HREAP, a stronger public health can create kind of again more and again, I think the county is actually up for it. They're interested in our ideas and our approaches, whether it's around community engagement or whether it's around kind of more flatter contracting processes. That's something we've leaned on heavily from First Five, even in our CHIP process around community leadership, replicating or not replicating, but adapting what PLTI, Parent Leadership Training Institute, has done through the work of again, First Five leading that. So it's sort of, I'd say, interrelated. It can sometimes be messy, but it's a great question around like how is our overall county structure changing in relationship to these new racial equity action plans that various divisions and departments are doing.
Thank you very much, Richard Falcon, United Latinos. Number one, I applaud all the efforts that are taking forward related to community engagement, but one of the things that comes forward time and time from a community organizing standpoint, the community is getting weary of answering your questions, and we're looking for the action. So I'm glad to see that there are folks within the county that are saying we're ready for action too, so let's go forward on that. But I guess my main comment on that, though, is that within community, though, we still see much of the work being siloed between what belongs to county, what belongs to city, what belongs to state, what belongs to the federal. And many times as we look for solutions, we say, oh, that belongs to them. We can't help you. How is your process here going to be helping to reduce that barrier, especially when it comes to things like equity and racial equity? Because the city's doing their stuff, the state's doing their stuff. How do you all come in alignment?
I mean, I think, Richard, again, that point is not lost. I mean, I think part of it is, we're working, one, you need not drive any further than Fruitridge and Stockton to see, a census tract divided by city and county to see it is the lowest, it scores lowest on the Healthy Places Index. It's strategic that the CHIP process is engaged in working in that community. I guess simply put, I think part of it is there are limitations, and at the same time, we also don't want to say, well, that's the county or that's the city's job. Like, I think we want to actually, public health wants to be able to tell you, here's the limits of what we can do, but here are some potential other approaches. Like, here, talk to this person. Because I agree. I mean, I think part of it is like, I think community members, people who live in these communities, where they feel like quality of life is radically different just crossing the street. The fact that you can access certain programs just by the asphalt that divides you is not something that is not something that's equitable, right? And I think part of it is like, this is why I think leading with this health framing, the health equity framing, is so critical, because it's something that isn't just for public health. It's something that other departments should be embedding in their work. There isn't an easy answer, and I think part of it is just creating systems of accountability, making sure that whether it's in the CHIP process or in the HREAP process, that we create processes that are not burdensome to the community. And part of it is, again, we have, I don't know, I wonder if people here have conversations of what committee should I sit on? And I feel like the county and our, we need to do the work to be how many, realistically, how many committees or work groups are we asking the same person to sit on? And I think we see that gap over and over and over again. And I don't know if we've really done the work to address that larger issue. And so it's complex around the city-county divide and all those other issues. But I also think we just have to do better, I think, in that domain area. I mean, there's really not much to say other than, we see certain neighborhoods and areas that are disinvested in. Government has had historically a hand in that, and they still perpetuate it, right, if we're being honest. And so, but what can we do to sort of unpack that and minimize those inequities? But I think part of it is hopefully the HREAP is a signifier that we're here to do the work. We're here to be honest also about what our limitations are, and then and partner with you all. Yeah, go ahead. Yeah.
Thank you for that question, and for calling out the silos. That's key, right, with any action plan, any work. And I think also, in addition to the action plan, that we are will encourage to dismantle the silos, right? And with dismantling comes the systems change, right? And with the systems change, it's a multifaceted action. And so if we go back to think about Gerlene's slide, where she had the map there, the timeline of the work that the county has done and the work that public health has done. and how that's come together, multifaceted systems change approach. And so I say that to call out that one of the biggest things that we've accomplished as a county and public health is working together with and submitting the application for GARE. And you can look it up, is that acronym for GARE is Government Alliance for Race Equity. And our application was submitted and it was accepted in March. And so we're really excited because that is the gold standard of how to embed equity principles, equity work rooted in all services, community-facing and non-facing services. Key, non-facing. So, because race and equity is rooted in all the services that we do. And so as we start to collaborate with county, with personal services, with DTEC, all other departments are also working with public health to move forward with these GARE principles, right? To organize, to visualize, to operationalize. So all building blocks to help dismantle those silos that you mentioned and to be accountable. So that's huge. And so I just want to thank you for calling that out, that we are listening to our community. We hear you and we see you. And so that is one of the steps that we're all creating together with the county and with public health. So.
Thank you. I'm Bob Hickman. I'm a member of the Maternal, Child, and Adolescent Health Advisory Board and the Maternal Mental Health Collaborative here in Sacramento. And I had a question. I think the process that you're going through is quite amazing and in depth. But I'm wondering, with both this process and CHIP, if there's going to be any opportunities to influence the providers of care that are actually working with the people that we care about to address systemic racism.
Providers of care, and maybe are you talking about like the managed care providers or kind of, I think there's a few opportunities. So we are meeting with the managed care providers on a fairly regular basis. There are, and again, I think part of it is really doing an assessment, like assessing like what makes Sacramento County unique, right? We have 4 managed care providers. I think most other counties have 2 maximum, I think. And that can make, doing business and providing healthcare in Sacramento County a little bit more challenging. And part of it is having relationships with those managed care providers, making sure they're aligned. They were incredibly supportive of selecting housing insecurity as a key priority for the community health improvement plan process. And also just making sure we get the commitments, funding commitments, staffing commitments required from those organizations in a way that's fair for the communities that they're serving. I would say overall, there's also work around the accreditation work we're doing around access to care, which is another big piece. We can throw data out there all day about insurance rates, but we know that's just truly like one piece. You can focus on how do we get the people who are uninsured, but having that person get specialized care, having to drive across the county to get the service that they need, how long is the wait time? These are things we really want to look at more in depth. And again, taking this kind of like user-centered design approach around what access to care looks like is going to be another critical piece. So I think we're trying to look at it at multiple scales, both what is the relationship with our managed care providers, what is the work that they're doing, and then also around the access to care piece. I don't know if there's other staff who want to weigh in on this piece.
Just that in true public health fashion, we're focusing a little bit more on upstream approach instead of like directly with the providers and provider care, but we hope to influence that with the upstream approach.
I did also want to give a shout out to Sierra Sac Valley Medical Society. We have done a collaboration with them around some racial equity work and opioids, and I think that's a good opportunity for the HRE team to plug into Sierra Sac Valley to do some of that work more in relation to providers. So really leaning on our collaborations and our partners who are already plugged into those networks.
Just maybe last week, our emergency preparedness department reached out to us. They're creating an equity lens plan so that they can implement it within their department, some more trainings and stuff like that. They have a coalition of a lot of health providers, so they've invited us to come and just be a part of that conversation. So a lot of internal wheels moving. So.
Hello, my name is Ivan Mendoza. I am with Adult Correctional Health under the Department of Health Services. And I really like the section you have on workforce and capacity building because, well, I've only been with the county for a year. I've been in government for about 6 or 7. And something that I've noticed is people bring, or managers have been bringing more people to the table, but they don't do a very good job at keeping them or at providing them with the tools to succeed in their new role or the new capacity as they're trying to be at the table. A lot of times this also ends up in like microaggressions because the manager or the person leading doesn't really understand that, so it isolates these folks or it makes them want to leave. So I think your plan includes how to like make managers or staff like be better, and I see the timeline goes all the way up to 2029. Is there something that's currently being done today to help managers or resources that they could use?
Yes, that's a great question and observation. And some of our staff have also been in different departments and county work. And I think the biggest place we heard this is in our on-track staff assessment. We heard the same comments being made as well. And so we created, in this past years, like a 7-part training series. There were 3-hour-long trainings, very extensive on like different topics that build on each other. And some were focused on all staff to like just like a foundation of equity knowledge and inclusion, just getting the terminology there. And then we had specific ones focused for supervisors and talking about like how do you do your one-on-one meetings to have these conversations and creating this safe space. And then we still, this is ongoing, so like in the next month or so, we have another one to talk about systems change and like how as like a supervisor group, which is a third of the organization, like how do we further this work and keep it going after like the trainings are over. And so we are, as a part of that goal for workforce in the next 5 years, trying to continue the knowledge we've built, creating new employee orientation, like videos, so that new staff, when they come, they'll have that foundation as well.
Yeah, we also provide monthly power hours, which is a space for public health staff to gather monthly, and we discuss different topics. So we've covered microaggressions, we've covered intersectionality, we're going to cover the spectrum of community engagement. So those are just things, and I invite staff to bring their own topics, bring their own questions. It's a space where I didn't really understand what they meant. What does health equity mean? And so this is the space to come and further go into those conversations. So, yeah.
Sorry. Also, leadership support is so important, right? So Dr. K has been very vocal in saying how this is a priority for all of our division and staff. And so when she's leading by example, it kind of helps provide support for us, our team, to say like, hey, like we are funded to do this work, but we can't do it alone. We need you, each supervisor, each staff member, to continue this with us in partnership. And so, and then another thing, your comment about engaging people on committees, we can't pay additional people to come, but we try our best to like have like health equity champions and like kind of informal recognition in ways to recognize people. And so we're happy to talk to you offline on like how to kind of do that.
Okay, thank you. And most of it right now, it's public health. So how do the other departments build this?
Excellent question, Ivan. And I will defer if Stephanie wants to jump in, as well as our DEI officer overseeing, county aside from public health. But as I mentioned with the GARE, and I go back to that because we also have our GARE subcommittees, right? And the goal for that is for everyone to have access to these tools in education and have a program where we have trained the trainers and internal projects where we will work on what's needed in our county as a whole, right? And so with GARE, once we start with those trainings and our tools, we will have more in-depth trainings where we can also go and work on those projects. We can also talk to the supervisors or encourage them to have these courageous heart-to-heart conversations. curiosity, right? And to define the microaggressions, define all the other issues that we often face. And I'll defer to Stephanie if you want to add anything or.
The Office of DEI and the DEI cabinet work in tandem together, and we work through 3 pillars. And those 3 pillars are our county employees, the community, and our policy programs and service deliveries. And our mission is to embed inclusion in all of those facets of the organization and the work that we do. And so you'll hear and probably see in the future, well, the Office of DEI, me, will be engaged in some of this work across the county. Like Aurelie mentioned, I am working with the capacity building project for our CBOs. And then also we're working on a couple of things to stand up a community racial equity committee. And so you'll see some things like that happening, but I want to save a little bit of it for later. But there is a lot of opportunity to scale what we learn from the GARE process across the county, and we want to involve all of the departments. The Health and Racial Equity team is leading in this work in the county, and we want to take some of the key learnings from there and scale it across. So thank you.
Hello, Marcos Lopez. Thank you for putting this all together. It's fantastic, and I know it's a huge step that the County Public Health has taken on. I have a comment and a question. The first is the comment. One thing that I recognize that there's a work in progress, it still hasn't been finalized, but one thing that I think would be really helpful is to put together a sort of accountability tool within the action plan. And what I mean by this is, with all these different action steps, who's responsible for making sure that the work gets done? So naming that in the actual document, I think, would be really helpful. Maybe not the actual person, but the actual office or the position. And the second one is the question. So I see that the action plan goes up until May of 2029. For an initial action plan, 5 years is really long. And so one thing that I was thinking about was, would it be useful perhaps maybe to scaling it down to 3 years so that way folks can see results in a more immediate manner?
Thank you. Your first comment about accountability, we absolutely have a table of like the steps and who's responsible, timeline. It's just not in this document, and so we will post that once the graphic designer makes it pretty. We have a Word document, but it's coming. The only reason we chose 5 years is because all of our other current plans are 5 years long, and so we kind of modeled it after that, but we do have annual progress reports in place to make sure like we're following the goals that we set for the 1 year at a time and then revising the plan as needed as we go over the 5 years. So at the 5 year mark, we'll do like all the full assessments again to get more feedback to make sure to set new goals if needed. So that's kind of our plan, but we are flexible if we do need to change it in between. And even at the 1 year mark, we're open to that.
I want to add from the Equity and Wellness Institute as well that when we are doing these racial equity action plans, it's really important that we plan backwards. And so the implementation tool is something that we're sharing and really working in collaboration with the HRE team. And it talks about who is responsible by what time. And we really believed in a tiered approach, which they took on as well, which is how do we do that effectively, but have really measurable goals so that the community can see that things are actually taking place. So that was a really great question. I want to thank everybody for their questions. We know that there's probably much more, and we're all available to answer questions during the very short break that we are about to take. So we are going to come back here at 11, but y'all, really quickly, y'all are about to see like the pride and joy of the day, which is the CBO presentations. So thank you so much. Be back here at 11, and we'll get started.
Welcome back. My name is Fabian Perez-Go from the Equity and Wellness Institute. I'm actually really excited to be here. I'm not the most talkative, but public speaking surprisingly is somewhat fun. But it's especially fun when I get to talk about something I'm incredibly passionate about, which is community engagement and research. So what we're going to be discussing right now is, I'll explain what it is first, is community-based participatory research. I say CBPR for short. So again, community-based participatory research. It's a research framework that centers the group that you're focusing on as a key partner from start to finish. It prioritizes collaboration, empowering communities to find equitable solutions together. So what tends to happen with research is I come up with a brilliant idea, and then I let you in at the very end, and then you say it's not going to work because you don't actually live there. Community-based participatory research makes sure that the people who are most affected, like I said, are there at the planning stages, implementation, and evaluation. So again, it was a wonderful honor to work with 5 amazing community-based organizations: Sacramento Native American Health Center, Asian American Liberation Network, United Latinos, Mutual Assistance Network, and Youth Forward. So they participated with me on a 3-part training series where we went over what CBPR is, data collection methods, and evaluative metrics. So again, the really exciting stuff for me. They met with me once a month for some technical assistance sessions where we worked together to come up with topics on their priority populations or communities of focus, and it all culminated with a findings and recommendations report along with a presentation. So the presentation is what you will be hearing today. So the way that this is going to go for the next hour or so is that each CBO will come up, present for 10 minutes, and then we'll have 5 minutes for Q&A, and then we'll move on to the next CBO. So the first community-based organization is Sacramento Native American Health Center. They unfortunately were not able to be here, but they did record a wonderful presentation for us, so you'll still be able to hear about their findings and recommendations for the county. If you have questions, I'll write them down, pass it off to them, and we can send it out via newsletter or with the slides from today. So SNAC is a federally qualified health center that focuses on Medi-Cal populations, also providing traditional care, and they focus on Native populations and also non-Native populations.
Hey everyone, thank you so much for joining us today. My name is Marisela Featherstone. I am Chicanx and a tribal member of the Lipan Apache Tribe of Texas. I'm currently the Outreach and Engagement Coordinator for SNAC. SNAC stands for Sacramento Native American Health Center. We're a federally qualified health center. That just means we service everyone. There are no ethnic requirements to receive care at SNAC. We're a health home hub, so we do medical, dental, vision, behavioral health, and community health across all our locations, which we now have 3. We have our original location, which is in Midtown, a South Sacramento location now as well, and our school-based health center coming out of Del Paso Heights in Grant Union High School. Today, I'm going to be talking about our traditional health preliminary survey and how that segued into participation in this community-based participatory project and the focus groups that we conducted as a part of that project. However, before I begin, I would like to start us off with a land acknowledgement. Now, land acknowledgements are not about placing blame. Rather, they create opportunities to learn, to grow, and to shift away from a Eurocentric lens that erases Indigenous people. SNAC encourages everyone to use a land acknowledgement at every opportunity to help normalize it and break those cycles of oppression. This one can be found on our website, and we highly encourage you use it. The history of the Sacramento area and the people is rich in heritage, culture, and tradition. This area was and still is the tribal land of the Nisenan people. Sacramento was a gathering place for many local tribes who have lived throughout the Central Valley and the foothills for generations and were the original stewards of this land. We would like to acknowledge the Southern Maidu people to the north, the Valley and Plains Miwok or Miwok peoples to the south of the American River, and the Patwin Wintun peoples of the west of the Sacramento River. We would also like to honor the Wilton Rancheria, the only federally recognized tribe in Sacramento County. We acknowledge that we are standing on the tribal lands of Sacramento's Indigenous people. Okay, so
introduction. In November of last year, SNAC completed a survey with its patients about whether they would like to receive an array of traditional health services if provided by SNAC. So this is the list that we came up with after hosting these surveys. So there are 9 different services that patients were interested in, and we went ahead and created a graph showing you the percentages of how much there was interest for each category. As part of the CBPP project, SNAC presented these 9 categories from the preliminary data collection survey to our Native Health Task Force, NHTF. So NHTF is a group of American Indian and Alaskan Native advisors who provide guidance to SNAC on its programming and services. Native Health Task Force members were asked to prioritize which out of these 9 topics they would like to see be the focus of our community-based participatory project. NHTF members identified 4 areas to further explore through 2 in-depth focus groups with American Indian and Alaska Native patients and community members. The areas of inquiry in this CBPP project were food sovereignty education, nutrition and traditional food classes or discussion, herbal remedies for sale, and additional cultural classes. So SNAC developed a focus group instrument, which was implemented during those 2 90-minute virtual focus groups, which happened in December. These questions asked participants about traditional health and what it meant to them, areas that SNAC should expand or prioritize traditional health services, and other areas of importance that the community would like SNAC to keep in mind when considering traditional health. 42 people were recruited into the 2 focus groups. However, 29 of those people recruited participated, 7 of which were current SNAC patients. The focus groups were recorded and transcribed, and we created a SNAC CBPP team, which consisted of myself and development associate Jasmine Karsa. And so we use content analysis to identify themes within qualitative data. The CBPP team independently coded transcripts and conferred to reach inter-rater agreement on all final coding categories and code-derived data. All that means is that we just printed out transcripts of the focus groups. We went through and just highlighted everything that kept reoccurring, everything that we thought was vital to the study. And then we created these themes that we thought kind of encompassed what was being discussed in the focus group. So a total of 6 themes emerged from the focus groups, which were accessibility to traditional health knowledge, holistic health encompassing mind, body, and spirit through a traditional lens, space as it relates to creating a safe, sacred, and connected environment, belonging and its correlation between community, rules as they relate to traditional protocol, teachers, facilitators, and recipients of those services, and of course, autonomy within our Native communities. So this ensuring that transmission of all traditional knowledge goes to future generations and doesn't just stop here with this generation. So here we went ahead and labeled all the themes and then calculated how many times each theme was being brought up or mentioned, talked about in this focus group, in both of these focus groups. So as you can see here, accessibility for both groups was highly important. And as far as SNAC is concerned, that's one of our one of our goals is to create accessibility. So we were excited to see that our community was also had concern regarding this area, and so this is one area which we would like to ensure that we're providing enough services for our community, and that we're creating space and a conversation around that, so that way it's not just SNAC who's doing this, but our community at large as well, and any other organizations that have the capacity to do that. So, although survey participants most frequently reported being interested in the sale of herbal remedies from SNAC, this one was also an area of differing opinion among focus group members. For some, this seemed helpful because maybe they don't have access to these sort of remedies, and so they wouldn't mind purchasing from a trusted source such as SNAC. Whereas others thought it would be controversial or even found it offensive, because there is a consensus out there in Indian country that our medicines should not be for sale. Part of that conversation included just creating workshops where we teach people how to independently harvest these medicines and how to use them rather than having those readily available for people. And so that kind of coincides with autonomy and ensuring that these practices make it to the next generation and isn't so exclusive. A bulk of discussion in one of the focus groups centered around who would be welcomed at SNAC ceremonies. So, if SNAC were to provide ceremonies, and we did find that there is some interest, we essentially would need to plan this out very thoroughly and meticulously. So if any other organization is looking to host something like this, it was recommended that we thoroughly look into who would be facilitating, basically vetting everybody that's going to be involved, and what that process is going to look like, because there are a lot of protocol regarding specific ceremonies. Like if we're doing a sweat lodge, there's a lot of rules to that. And so it can get a little murky there, because depending on what tribe you're going to be able to facilitate, or what tribe that facilitator comes from, or however it is that this specific aspect of this would be taken on. There could be conflicting ideas there around how, or just conflicting tradition, basically. So it's important to work with your local tribes and representatives, just to ensure that you're covering all your bases, that you know exactly what this is going to look like, and if this is even something that should be offered from your organization. So for us, this is still a topic of conversation. We're still kind of going back and forth on that, whether this is something that we feel that we have a right to do, or if we should leave this to our local tribes and just focus our efforts in that way. Discussion around food sovereignty and education, or food sovereignty education and food kitchen demonstrations. These were in alignment with preliminary survey results. So both survey and focus group participants reported that these, as well as other cultural classes, should be provided by SNAC. And so one thing that came out of that is our teaching kitchen and the plans for a garden. So we are currently building that teaching kitchen, and our in the garden is still in the works as well. And both of those will be coming out of our Florin Road location. So our next steps, as I sort of mentioned already, we're taking these findings from the CBPP project back to our Native Health Task Force and our executive leadership, as well as our traditional medicine program or Healing Ways program, just to ensure that we're all on the same page, that we understand what the need is of our community and what our next steps are going to be to implement them. Now, SNAC will also use findings to discuss topics like ceremony or sweat lodges or the sale of specific herbal remedies, where there may be differing points of view there. So again, we're still talking about what that could look like, whether we think that that is something that we have an obligation to do for our community, or if that's something that we support somebody else to do that might be more qualified. And now our third point here is that SNAC will expand traditional health services in a way that best fits the opinions presented in this report. So maybe that looks like creating additional classes. And like I said, we are in the process of building our teaching kitchen. So I believe our next steps for that would be creating the curriculum around that, what that's going to look like, and maybe talking about how we would implement our potential garden once that comes into play as well. And so I just want to say that we highly encourage the state to work with our local tribes here and other Native nonprofits. Wilton Rancheria, as I stated earlier, they're the only federally recognized tribe here in Sacramento. And we have other organizations such as Native Sister Circle, SEBA, Sakui, that are already doing a lot of the work to uplift their community. And so it's important to put our efforts into those organizations that already exist. There's no reason that we should be trying to reinvent the wheel. That work is already out there. So just amplify their voices, give your money to them, just help them any way that you can, and collaborate. You know, it's important to build those relationships and that repertoire. But yeah, thank you so much for listening today and for being a part of this conversation, for making space and allowing us to be here, have a seat at the table. We highly, highly appreciate that. If anybody has any questions, please feel free to email me. My email is here, maricela.featherstone@snac.org. Thank you so much, and we look forward to seeing y'all in community. Thank you.
So up next, I would love to welcome Lee Lowe from the Asian American Liberation Network, a nonprofit that focuses on social justice and liberation, specifically with the Asian American and Native Hawaiian Pacific Islander population.
Hi everyone, my name is Lee Lowe. My pronouns are she and they, and I'm the executive director for the Asian American Liberation Network. I do want to make a correction to that. We serve the Asian American community very specifically, especially as we are in partnerships with our Native Hawaiian Pacific Islander partners to also divest from the language of AAPI that has historically erased our Native Hawaiian Pacific Islander in terms of funding, representation, and et cetera as well too. And so in our conversations with them, which we will also talk about today, is how do we just be honest about who we are serving and say who we are serving, and for those who we are not serving, allow them to be invested and to really lead the work that they would like to see as well too. So just really quickly, our team, we were really excited to be invited to be a part of this work. Really, ALN and our partners in the region, our Asian American, Native Hawaiian, Pacific Islander partners, have already been undergoing a process to evaluate the impact of our communities as it relates to COVID, anti-Asian hate, and also anti-Blackness that we are seeing in our communities as well too. And so we were already in a process of wanting to be able to understand our landscape. What are the challenges? What are the needs? And what are the assets that really exist in our communities that have not been invested in already? And what are the opportunities here for our communities as well too? And so as a part of our team was myself, our community organizer, Crystal Lee, and also our research consultant, Everyday Impact Consulting as well too. And to share a little bit about our priority population, right? We do say this project specifically was Asian American, Native Hawaiian, Pacific Islander, and that is only possible because of who was at the table with us. And so our priority population was really to focus on the impacts of COVID as it relates to also income, language barriers, and limited access to personal protective gear as well during at the height of COVID, and as you all may know as well too, the rising anti-Asian hate that our communities experienced since March 2020 due to a lot of racist rhetoric, and alongside what folks consider to call this a racial reckoning in 2020, even though many of us have already been experiencing racism, it is now something that can finally be spoken about without it being invalidating of our experiences. And along with this, we also saw too, as the rise of anti-Asian hate really impacted the mental health and well-being of our communities, as a lot of our communities experience high rates of anxiety and threats to their personal safety as well too, in just going to grocery stores or even just operating their day-to-day as well too. And so we call this Asian American, Native Hawaiian, Pacific Islander because we were grateful to be able to be in partnership with our partners that really represent a diverse experience in the Sacramento region as well too. First and foremost, some of you may have already heard or know, but Asian American, Native Hawaiian, Pacific Islanders are not a monolith. We have a range of experiences in terms of our immigration history, the way that we are impacted by education and income levels as well too, that really leads to the very different experiences and health outcomes that we see today. And so ALN is lucky to be a project lead on this, to really be able to convene partners who can represent a really diverse group. And even the partners represented here does not completely represent the entire diverse ANHPI community in Sacramento. But we are lucky to have undergo this project with Council on American Islamic Relations Care, EBASI, East Bay Area Youth Center in Sacramento, Empowering Pacific Islander Communities, EPIC, and Filipino Communities of Sacramento Vicinity, FCSV, and Sacramento Filipinx LGBTQIA, also known as SacFil, and Hmong Innovating Politics, HIP, who's also in the room here today with us. And so we were really grateful to have been entrusted by our partners because even within our own communities, a lot of times AAPI language does not and has not always included us too. And so many of us have been hurt by this label as well, more than we have been served by it. And so to be an Asian American serving organization and to be entrusted by our partners who have seen this label hurt them time and time again, ALN is really humbled and really honored to have that trust with our partners. And so as we co-designed a community-based research for our communities, really to understand what our communities are interested in this moment and how we would like to move forward, we were able to co-design the base questions in which we were assessing really the health outcomes, needs and challenges and opportunities. Also be able to identify what is the relationship our communities have been having with our county and city governance as well too. And alongside also identify what are the power building opportunities for our communities and how do we continue to ensure that there is leadership beyond us and for future generations. And with those basic research questions, our partners were then able to take these questions and further specialize them according to their community population so that they can tailor it appropriately. And so maybe we are not asking the same questions we ask young people as we ask elders as well too, but making sure that the essence and the key outcomes are able to be carried and And we entrust our partners that they know their communities best and they are given that liberty as well to make those decisions. So our key findings for this project is really that our A and HPI communities are simultaneously experiencing the compounding layers of historical and systemic oppression. And so we understand that racism also leads to discrimination and limited resources. It also leads into overall resulting in many health barriers of like mental health, behavioral health, physical health, emotional, and even spiritual. And this component is really important because spiritual health is how our communities understand our well-being, and it is a language that is not seen in Western models of health, and is often, therefore, why there is such a disconnect with our overall well-being and our mental health compared to how mental health is evaluated in Western spheres as well. And along with that, our A and HPI communities express a distrust and disempowerment due to the historical relationship between our communities and government entities. And so when you consistently uninvest in our communities, when you consistently not show up for the needs that our communities have asked for, it is going to lead to generational distrust, in which when there are listening sessions, our communities feel like there is no point in attending because what has this led to? Our parents, our grandparents have attended these things. We have asked many times, there have been advocates in our communities for many years who have asked for change, and we have yet to see any of them. And so how our communities evaluate is what is the value of showing up to this listening session at 6 p.m. versus preparing dinner for my family? And those are the ways in which showing up to these listening sessions is deprioritized. It's not as important. We don't feel empowered to be here in these spaces to actually trust that you will follow through on the words that you have, especially even more so when we have provided feedback and what comes out of it looks really different from what we're familiar with. Additionally, I also want to point to the fact that A and HPI power building organizations, that is to distinguish from direct service organizations. These are organizations that are doing the work in terms of education, in terms of advocacy, building leaderships in our communities, making sure that our voices are not unheard or gets forgotten or even erased, because we know systems do love to erase us. That making sure that our voices are present, but that these types of relationships and organizations are underinvested by the government because they feel like these organizations consistently results in a challenge for their county, as opposed to being a partner in building a better and stronger Sacramento. And so I think alongside with this is a lot of our A and HPI communities also want to consistently work collectively to distinguish that there should be specialized funding for them to carry out the expertise that they know work in their communities, and allow them to be collaborative as well too. In the A and HPI community, we see it as a coalition within a coalition, and that folks in the Hmong community, they know how to specialize what outreach looks like, but there are things we can share and align resources so that we can really strategically really be able to share resources so that we can specialize in the other areas without like these templates or projects. As I've spoken to, the history of underinvestment really results into our governments really perceiving that the government is unreliable and really resulting in them consistently being disengaged in these processes. And lastly, the theme is that racism impacts everyone and impacts each group differently. And so policies and procedures that have consistently demonstrated like an umbrella approach to this has resulted in not addressing the disparities we see in our community. And very specifically, even within the A and HPI communities, is that there are disparities within our A and HPI communities that is erased distinct because of aggregated data. And so a lot of times there's one checkbox for our communities, and therefore policies are not developed with disaggregated data in mind, or in order to like really invest in our communities and address the inequitables and inequitable outcomes that our communities see. And so just leading into the key recommendations is, one is to really invest in Native Hawaiian Pacific Islander communities' health and wellness centers. These community members have not been served for a long time because of the erasure of the NHPI label as well too. It is also investing in power building and organizing communities working towards systems change and transformation. And in addition, and as we spoke about earlier too, that these are the critical entities that is really consistently bridging our communities to government and repairing trust that our government has really broken in many times. And lastly, to include our communities. And so it's to distinguish investments and engagement strategies between the Asian American and Native Hawaiian Pacific Islander community, and that includes recognizing that when you are serving or when you're going to fund a population, right, you don't just identify one organization that has an umbrella, you invest in them and then you clean your hands, but really that you are intentional about investing and distinguishing the difference of investment, because each communities have very unique needs as well. And lastly, that the County of Sacramento should fund and include partnerships with community-based organizations that help close gaps during the planning, design, implementation, and evaluation phases of using public-funded initiative dollars. And so our AAPI community continues to really demonstrate the resilience, innovation, and cultural assets that we see and know how to address equity gaps. It is just a matter of investing in these strengths. And lastly, for just the last slide, is how we know that how do we know that the county is doing this? Is that they are building mutually beneficial partnerships between community-based organizations in the County of Sacramento. There is also consulting with community-based organizations throughout multiple levels of decision-making, problem-solving, innovation, and feedback loop, and really building ongoing partnerships and engagement opportunities that exceeds beyond the individual projects, allowing partnerships across projects and areas of work. And questions, that's all. Thank you.
Yeah, hi. I was wondering, in terms of the impact of systemic racism in your community, do you have any information about the impact on perinatal health outcomes?
Perinatal health outcomes, we don't have that data, and a lot of it has to do with the lack of disaggregated data in our communities, so that we can even see how each communities experience health outcomes in different areas as well too. And so it's very hard to be able to point to data, right, to say that like the Hmong community experiences this disproportionately higher than this community. And so that is the struggle that our communities consistently advocate for, is stronger data that can really demonstrate the truth of our community's experiences.
Thank you.
In the beginning, you shared about holding, well, I guess I will ask, how do you hold space for some of those anti-Black discussions within your community? And what do some of those discussions look like?
Yeah, so we see our role is to get our own community together, right? And so it is not on the responsibility of anyone else but us to really do the education, to really be able to identify our shared history, our shared challenges, and our shared challenges, as well as how the Black community, a lot of the movements that the Black community led is what led to many of us being here today. And so even myself being Hmong and my parents are refugees, right? It's doing the education about like what the civil rights movement has led to really allow Southeast Asian refugees to be here, and what is the impact of these things, and also being able to identify. So a lot of it comes in like both micro relationships, as well as it is also holding workshops as well too, to talk about how is like anti-Blackness, what does anti-Blackness look like? Why does this show up? Why did anti-Blackness in our community show up at the same rates as anti-Asian hate, right? And really doing the education that this was a very strategic, methodical like media play to to really portray Black folks as the perpetrators of anti-Asian hate when historically and the data shows that this is not true. And so being able to really demystify a lot of the things that comes through media, be able to do that education with our communities and in like providing informational materials of such is really some of the ways that we've done alongside the work we've been doing to address anti-Asian hate as well.
Okay, great. Now I would love to welcome Richard Falcon from United Latinos, a nonprofit that focuses on people that are of Latin American or Caribbean descent on education and civic engagement.
Thank you, everyone. My name is Richard Falcon. As Fabiana said, I'm with United Latinos. We are a nonprofit organization that focuses on civic engagement, especially within the electoral process, education, and those opportunities to advance within that education, and recently within the environmental justice realm, especially around air quality and water quality for our communities. And we're so happy to be here with all of you, and I want to share with you some of the information we were able to gather from within our community around the subject of health equity and racial equity related to health, especially here for Sacramento County. Let's see here. A little bit about the team. Erica Guzman is one of our community organizers. Erica is a first-generation Latina who is here and is studying health, as a matter of fact, right now in nursing school. She has also come on to help reach some of the that community, that first-generation community that still feels disenfranchised and disengaged from what can be for that community. Pano Roditis is another community organizer. Pano is someone of Argentinian Greek descent who also works with us as well, has been involved in many social justice movements, and is also a local artist here within town, a performing artist. And so he brings forward a lot of that arts community that we have in place. Vince Valdez is a second-generation Mexican-American working in the construction industry, working as a union worker, but also helping out with our community organizing, especially on the ideas of food, of urban forestry, of composting, and these kind of things like that within our community. So this is the great team that we assembled as we put forward these focus groups. A little bit about the priority population. We wanted those who participated to self-identify as being from within any of the Latin American countries that we have here. I think there are about 17 different Latin American countries that are represented when we talk about Latino, Chicanx, Chicano, Mexicano, whatever it is. There are so many different, very, very much, as my colleague Leo said, we are not a monolith. We have conservative, we have liberal, we have independent, we have those who have language challenges, visa challenges. Culturally, our foods are different, our religions are different, so many things that are different about us. So again, so that we are not a monolith, how do you address and find out the best information on there? And it's challenging. And you as Sacramento County, as a government agency, you know, when you talked about that section where we was moving at the speed of trust, we really need to allow that speed of trust because it has been years in the coming to get to this place, and it's going to be years to take us to that place where they develop that trust. People living in Sacramento County, some that are involved in receiving Medi-Cal, some who are not, who are receiving private insurer, some who have no health care available to them at all, again, because of things like visa status. Artists, blue-collar workers, business owners, caregivers, students, we tried to get to as many as possible. I came into this business as an artist. I'm a performing artist. I am a theater artist with a Latino performing arts community that later I said, wait a minute, the arts is a great way to reach community. So I recommend to all of you here within Sacramento County, as you think about your community engagement, don't forget your artists. They can help you to break through those. Documented and undocumented immigrants, and a wide range from 18 to 67. So we held 2 focus groups totaling about 31 people. We did written surveys that were out there. We did provide stipends because we wanted people to feel their time was of value as they were giving us the responses to the questions we were asking. The project was led, our project team led the discussions guided. Vince, Bono, Erica were all in the rooms with us anytime we met with the people. What this helped is then we can collect the live information from the perspective of 3 different people as they interpreted the answers that were being given. So having those different perspectives of just people listening and writing the information was extremely important to us. Translation was provided for our Spanish speakers to make sure that they understood what those questions are. Key findings, interesting, because one of the questions was, how do you get your information? Univision, Telemundo, radio, Facebook, social media. But interesting, one of the things that was not prompted but came up was the Postal Service. Everybody has their own way of getting their information, but all of them said, oh, you know what, but I opened my mail. So just something for you to think about there. And of course, social media. Interestingly enough, for those of you, because we talked about provider accountability, local medical and dental services were viewed as financially inaccessible and low quality from within our community. So let that sit with you for a minute. And participants expressed a lack of dignity and empathy from local care providers. So as we think about these changes we want to make, as we talk about provider accountability and that, we need to think about that. Many participants, and you're reading, I'm not going to go through it all, they go back to Mexico for their care because they find it less expensive, they find it more relevant to who they are, and they trust their doctors more. Just kind of a side person, an artist that I work with still goes back to France for their care because they think it's cheaper. So just something for you to do that. Now, some interesting things that came up, that even from the participants that we were talking with, that there was a growing resentment from participants on other immigrants that were coming forward. They've been here 2 generations, 3 generations, many of them trying to get their services, and they're going, but why are the ones coming over get better services than we do? So even internally, we have our problems. And that was something that was very, very interesting to me. The themes, healthcare is poor and inaccessible and unaffordable, negative experiences, community members following social media and influencers closely. There are a number of influencers that they reach out to for their information. Another area on here was how non-English speaking parents rely on their children to go to the doctors with them, or to go to the county to fill out their paperwork, or those kind of things like that. But many times, those kids don't know what the words are on the applications that they're translating for their families. So their parents are getting the wrong information. And again, most people prefer to go out of the country to Mexico to seek medical and dental procedures. Some of the themes, I'm not going to go through all of them in detail, but just on the highlights. Engage and coordinate with your community leaders. There are many that are out there. And again, we are not a monolith. So find those community leaders, find those culture bearers, find those artists who can get you into those communities to get the information that you're looking for. Craft that culturally appropriate mental health resources, because there's stigma within the community that I serve. I find that stigma amongst all my other colleagues demographically that are out there and culturally in there. My people don't speak about their mental health. It's embarrassing. But there's changes that are working along the way. Culturally sensitive training, not only for your workers, but for your providers, and enhanced methods of communication. Be creative with your communication. Because if you're going to move at the speed of trust, the different forms of communication you're going to find that's going to be effective is going to take time to get there. Provider accountability, we've talked about that a lot. You can see it within the slides. But genuine, authentic implementation of recommendations. Be intentional in what you're going to be doing. And keep your community up to date. Because, even the people that I went to, they were like, okay, when are you going to come back and tell us how it went, Richard? And I'm here for any questions.
I would love to invite Sarah Gaston Michael from Youth Forward, a nonprofit that focuses on youth organizing and leadership.
Thank you for that introduction, Fabian. My name is Sarah Michael Gaston, pronoun she, her. I'm the Deputy Director at Youth Forward, and today I will be presenting on cultivating outcomes with youth of color in Sacramento County. I want to share a little bit about myself. I was born and raised in Sacramento. I love this region and the people in it. A few years ago, I had the pleasure to go to Baltimore, Maryland, and Johns Hopkins and get my Master of Public Health and focus on child and adolescent health. And so I came back home to apply what I learned in school and continue to give back to my community. So I'm really happy to be here with you all today to talk about how we can learn about advancing racial equity and how we can work together to do that. So these are my colleagues that worked on this project with me, Ray Thomas Haysbert, who goes by Ray, and Nia Moore-Weathers. And Ray is our community organizer. She works with our young people in the high schools. And Nia is the manager of training and development at Youth Forward and makes sure that our staff knows how to do all the things that we do. So our priority population, as you might glean, are high school aged youth 14 to 18 from diverse racial and ethnic backgrounds and low-income communities. And a little more about Youth Forward. In the Sacramento region, we have emerged as a leading youth advocacy organization. We're working with county officials on expanding peer mental health services, with city officials to advance racial equity in their policymaking, and with criminal justice groups to reduce the incarceration of youth and adults. We also have a tribal department at Youth Forward that organizes a Native youth group and helps tribes across the state advocate for funds to uplift their communities and to restore their lands and water due to illegal cannabis grows. Additionally, we lead the Sac Kids First Coalition, which is the city's largest grassroots coalition, working on youth issues. Many people in this room are part of that coalition or have seen some of that work. And we're unique in that we're not a direct service organization, but rather an organization focused on changing systems and increasing public investments in children and youth. We also promote youth voice and leadership in the policymaking process, meaning we listen to them and what they want and need to improve their health and well-being, and then we train and empower them to be leaders in making that change happen and advocating for implementation of their ideas and solutions. So here was our process for this community-based project. We used focus groups with questionnaires, and we put the questionnaires or the questions on paper because everybody learns differently, and with young people, they need something in front of them versus just auditory. And then we had some key informant interviews, and they were all the same 6 questions. We did this at 3 high schools through our Motivate Youth program, Luther Burbank High School, Hiram Johnson, and Rosemont High in Sacramento City. And then we conducted interviews with young people that are involved in us at Youth Forward in various different ways. We had 37 youth total, and then our main goals were to find out what do young people need to feel safe when talking to an adult, right? How do young people like to be communicated with, particularly when talking with adults? And then how has racism caused them or their family to be treated differently? What services do they think would benefit or help them or their community? Those were our main goals in doing these focus groups and what we wanted to learn. So here are the key findings. So I'll go through and explain a little bit. The first bullet point, about 80% of young people said this, is that they need to form a bond and have trust and respect from an adult to feel safe talking to them. They like in-person communication because they can read body language. And one student said, I get to know people's real values and get help from them when talking in person. They like text messaging so that they can think about how they want to sound and formulate a response through text. And then youth also value when adults are active listeners and honest, supportive, and understanding towards them. The middle one about racism, Some of the students, they generally were talking about how racism has caused them to feel less than, to hate their skin, or fear deportation. Many students of color talked about people talking to them in a disrespectful manner and viewing them as gangsters or criminals. And then the last one, several youth think that their community would benefit from free mental health services and healthcare, meditation classes, as well as better, which we interpreted as reliable public transportation to and from school. One participant from the interviews said that free therapy would reduce stigma and people would be comforted knowing that the cost of services is covered, and it could prevent youth overdosing on drugs. Very insightful young person. So our themes, as I've mentioned, the first one was building trust with young people, providing them respect and bonding with them. And then the second one is to have face-to-face communication, to understand their values, people's intentions, and to receive help. The third one is students of color feel disrespected and talked down to at their school and in the community because of their race. And lastly, they asked for free therapy and healthcare and better buses or public transportation. So these are our key recommendations, and this is my lovely staff at Youth Forward. We're beautiful. The first one was improving the social infrastructure. So vulnerable young people want free healthcare services and access to reliable public transportation so that they can get to social, educational, and economic activities. And then the second one is having culturally responsive school engagement and outreach. Essentially sending people that share young people's racial and cultural backgrounds and have lived similar experiences to their schools to talk to them about the resources and services that are available to them in the county. So how do we know that this has worked? For us, it really looked like students knowing who Sac County Public Health is. None of these young people, adolescents, know who we're talking about when we mentioned the entity or agency we were working with. And so the call to actions would be to focus outreach at the schools, going directly there to youth and speaking to them face to face, requesting to host school-wide assemblies or presentations in classes about the county services, disseminating information through brochures, billboards, the county's website and their social media, and then providing updates through school websites and the student support centers, which are where the social workers and clinicians are, and then through their school emails. Most students, particularly in Sac City Unified, have a school email, and I've seen even ads online or on Hulu, and I'm like, this can definitely be something that our young people, if we put it out there and really emphasize who this is and what's available to them, that they'll gravitate towards it. And as community partners, that's something that we can do to direct them to that, to show them what's available. So that's it for me. Thank you so much. I'll take questions now.
Hi, this was great. I really enjoyed your presentation. My name is Sydney Adams. I'm an MPH student at Sac State. And apologies if you already mentioned this, but just how did you choose the 3 high schools that you went to?
Youth Forward is at those 3 high schools doing a lunchtime near-peer mental health support program. So we provide a safe space during lunch. Students can come and eat, decompress, and we talk about advocacy, we talk about the mental health services at the school, and just a variety of things. So that's how we pick the schools. We just kind of inserted ourselves where we're already at versus recreating. Yeah.
Katie, Rob, and Lanisha, Jean or Jean? Okay. From the Mutual Assistance Network, a nonprofit that focuses on youth and families in the Del Paso Heights Art and Arcade and North Sacramento area.
Hi, everyone. It's officially afternoon, so good afternoon. Thank you for the introduction. I see a lot of our partners and friends in the rooms, though for those of you who don't know us, Mutual Assistance Network, we are approximately 30 years old. We focus on social and economic development for Del Paso Heights, Arden Arcade, and the surrounding northern Sacramento communities. As part of our work here is that while this is our project team, just a little bit about our organization in general, about 65% of our team members, there's over 50 of us, have either lived or currently live in the communities that we serve. And it's important for us to ensure that our staff members are reflective of the cultural, the ethnic, and linguistic diversity of the neighborhoods in which we serve. So when we first embarked upon this project, we really wanted to also think about youth. We wanted to think about youth in a way of like, there's often times where we are thinking and designing programs and services that directly affect youth and their families and the communities in which they live, but yet they're often not at the table. And so that prompted us to think about, let's talk to youth about their perception of Sacramento County public health, what kind of barriers maybe they experience, if at all, accessing health or mental health services, as well as their impacts of racism and experiences around that, and just overall like engagement. Like, how do you want us in these institutions to engage you? And so for this particular project, who best to engage our youth would be our youth services team. And so a number of them couldn't be here today, but I wanted to give a big shout out and accolades to James, Brandy, Shakur, and Asante, who really supported with the data collection in this project. And then of course you have myself and Lanisha here. For this particular project, we really wanted to focus on youth that are 14 through 26. And so we did a number of methodology to collect our data, which I'll talk about in just a minute. But when we did our deep dive as to who it is that we were able to engage, the majority of our top 3 age demographics were 14, 16-year-olds, and 18-year-olds. As well as here's our ethnic breakdown. Primarily, we saw a lot of responses from our African American community as well as our Latino community as well. And then you'll see here the zip code areas that we also primarily focused in the north area, that we saw a lot of respondents from the north area, although we wanted to make sure that we heard voice from other folks in county as well. And then our process. So we knew that to get the greatest responses that we would have to do a multi-level approach to this data collection. So we first started with, drafting, like, what is our strategy? What is that going to look like? Then we also did a questionnaire, paper, and a survey monkey for us to easily receive the data and be able to analyze the data. We did 3 focus groups and really leaned on some of our current partners where we knew that we could also easily access youth. We did a focus group with our Passport to Adulthood workshop series, which is a adult preparation workshop series for youth, as well as partnering with Movement for Life and Mercy Housing, who have several facilities and neighborhoods in which we serve.
And so for some of our key findings and themes and what we wanted to focus on, right, was health accessibility, mental health services, racism, perception of Sacramento County leadership and county supports to families and communities, and youth engagement. And so within our very first theme with accessibility of health and mental health services, what many of our youth felt is that medical and mental health staff were not reflective of their cultural, ethnic, and linguistic demographics, right? Of those that were served, youth were left feeling like they were not heard, didn't have the appropriate care. And one youth in particular shared that bias has led to unpleasant interactions with medical professional staff. They felt judged, talked down to, rushed, and dismissed. And we're talking about youth here, right? Not even adults. So if we're already establishing that youth feel like this, right, what kind of voice are they having to advocate for themselves when it comes to medical care, right?
and mental health services. The next one that we focused on was racism. In one of the direct quotes was, many white providers are uncomfortable, unexperienced, or unable to talk about racism to youth. Blackness with me, or they feel like a hero when they do, which can really make a youth feel unempowered, right? To speak about what it is, what challenges they're facing when it comes to education, when it comes to their health, right? Youth reported that they have experienced racism in their own communities due to the color of their skin, language, spoken, religion, right? So again, when they're in schools, when they're in their own communities, going to grocery stores, what are these youth already facing in their own communities? The next that we wanted to focus on was youth engagement, the perception of county leaderships and supports to families and communities. When asked how Sacramento County leadership demonstrates what's important to them and their community, some of those themes, youth responded. They wanted to be engaged in the following ways. They wanted focus groups, right? They want to be a part of the process. They want to be heard. They want youth panels. They want to come out, right? They want to be create. They really, really want to be heard and want us to hear what they have to say. The other way that we connected through them also was social media, youth advisors, our surveys, and our youth events. Youth events was one of the biggest ways we got, to Katie's point, through our Black Child Legacy CIL leads and the youth. That was our biggest way that we got most of our responses. Some of our key recommendations was ongoing cultural competency training. In workforce development programs, we want to attract and retain a diverse workforce. This can ensure that medical staff reflect the community. This can ensure that, education teachers reflect community. We want to increase support to navigate services and programs. We want to create trainings for people to come out to. Providers and educators can continue education training to address racist and medical educational myths. We want to hold people accountable, right, and admit their own racist actions. We want to validate the youth by listening to their feelings. We want them to ask and receive feedback from our youth. And we also want to allocate resources to research. We want to call out microaggressions, create reporting and evaluations and intervention systems. And we also want to modify recruitment strategies and conduct community level needs and assessments. With our other key recommendations for youth engagement, use many strategies to engage youth to solicit input. We wanted to go where youth gather. Again, being out in community, meeting the youth, seeing them, giving them the opportunity, and hear their feedback. And with perception of Sacramento County leadership and supports to families and communities, we want to engage communities, right, that are Black and Indigenous, right? We want to make sure that those communities that are historically disinvested in have a voice, have advocacy, and are at the table to make decisions. Not just people making decisions for them, but really truly hearing them and getting their feedback and investing in our communities. We want to make sure that we are focusing on awareness campaigns and building deeper collaboration with other government agencies.
I'll just quickly round this out because I know it's close to lunchtime, but again, that piece about accountability, which is it's the most important topic in the room, right? One of the big pieces that we found, recommendation for accountability, is establish a liaison role. First Five is in the room today, and they might talk about this later, so sorry, spoiler alert, but we've had a working relationship for decades now. Where we have a liaison role and folks that we can call to really increase better services for families, right, and better outcomes for families. And it's worked beautifully throughout the decades. continuously be in community. I guess that's just the way to sum it up. And I know our other organizations have said that over and over again. Just be in community as often as you can at all levels of leadership, especially as you move further and further away from direct services. The importance of being really intentional about being a community, holding your meetings in community, frequently local, visit local businesses in the communities in which you serve so you can really understand the day-to-day workings of community. We talked about hiring events. We have 3 community centers. You're always welcome at our community centers to host meetings, hiring events, whatever it is that you might need. And then continuing the dialogue, always continuing the dialogue with community, hosting a community advisory group to pull together some key leaders in community to talk with you about the issues and give you guidance and direction. And then, of course, continuing the methodology. So now that you're here and you have your plan, what comes next and how is it that we're going to get that messaging out to community residents? This is my contact information down below if you'd like to connect further and continue the dialogue and really talk about how it is that we take this plan and move it into implementation.
Please join me in thanking all 5 CEOs for their wonderful work.